Welcome to this session on prefertilization events in embryology. Before fertilization occurs, several important steps take place in both males and females to prepare for the creation of new life. Excited to learn more? Let's jump right in. Everything begins with the male and female gametes, sperm and ovum. These specialized cells are haploid, meaning they carry only 23 chromosomes each. When they combine, they restore the normal 46 chromosome count, crucial for human development. Now, let's explore an essential process in gamete formation, meiosis. Both sperm and egg undergo meiosis, a special type of cell division that reduces chromosome numbers by half, promotes the exchange of small amounts of maternal and paternal DNA via crossover during meiosis 1. This ensures genetic diversity and prevents chromosome doubling in offspring. Errors in meiosis can lead to chromosomal abnormalities like Down syndrome, trisomy 21. So, sit back, focus, and let's dive into the fascinating world of gametogenesis. In females, gametogenesis is called oogenesis and starts before birth. Primary oocytes are arrested in prophase 1 of meiosis 1 until puberty. Each month, one oocyte resumes meiosis and completes ovulation. Prior to ovulation, the ovum finishes meiosis 1 and begins meiosis 2. It then enters metaphase where it stays until fertilization. Hormones play a crucial role in regulating oogenesis. The hypothalamus releases gonadotropin-releasing hormone, stimulating the pituitary gland to release follicle-stimulating hormone and luteinizing hormone. FSH stimulates follicles and LH stimulates ovulation. In males, sperm production is called spermatogenesis, begins at puberty and continues throughout life. It takes place in the seminiferous tubules of the testes and involves three main phases. Primordial germ cells arrive in the testes at week 6 of embryonic development and remain dormant until puberty. At puberty, primordial germ cells differentiate into type A spermatogonia. Type A spermatogonia undergo mitosis to provide a continuous supply of stem cells throughout the reproductive life of the male. Some type A spermatogonia differentiate into type B spermatogonia. Type B spermatogonia enter meiosis 1 and undergo DNA replication to form primary spermatocytes. Primary spermatocytes complete meiosis 1 to form two secondary spermatocytes. Secondary spermatocytes complete meiosis 2 to form 4 spermatids. Spermatids undergo a postmeiotic series of morphological changes called spermiogenesis to form sperm. Newly ejaculated sperm are incapable of fertilization until they undergo capacitation, which occurs in the female reproductive tract and involves the unmasking of sperm glycosyltransferases and removal of proteins coating the surface of the sperm. This process is controlled by hormones. FSH stimulates spermatogenesis, while LH triggers testosterone production from Leydig cells. Understanding prefertilization events is crucial in the clinical practice. Let's look at some common disorders related to gametogenesis. Male infertility, oligospermia. Characterized by a low sperm count in semen, typically less than 15 million sperm per milliliter, which may affect male fertility. Azoospermia, characterized by the complete absence of sperm in semen, leading to male infertility, abnormal sperm morphology, and motility. A condition where sperm have irregular shape or structure, affecting their ability to fertilize an egg. Similarly, other conditions that impact sperm production and cause male infertility include Klinefelter syndrome, cryptorachidism, varicocele, hormonal disorders, and drugs. Female infertility, polycystic ovary syndrome, characterized by irregular menstrual cycles that disrupt ovulation, often leading to infertility and metabolic issues. Premature ovarian failure, a condition where the ovaries lose their normal function before the age of 40, leading to infertility. Endometriosis is a chronic condition where tissue similar to the endometrium, lining of the uterus, grows outside the uterus, causing pain, inflammation, and potential infertility. Pelvic inflammatory disease. is an infection of the female reproductive organs, usually caused by sexually transmitted bacteria, leading to pelvic pain, fever, abnormal discharge, and potential infertility. Anovulation is the absence or failure of ovulation, where the ovaries do not release an egg during the menstrual cycle, leading to irregular periods and potential infertility. Female infertility is also caused by hormonal imbalance, drugs, and infections. Environmental and genetic factors, including smoking, obesity, and hormone imbalances, affect both male and female fertility. Let's recap prefertilization events. Primordial germ cells move to the gonads during the fetal stage, where they undergo mitosis, divide, and produce copies. Under hormonal regulation, germ cells develop into female oocytes and male spermatogonia. After a series of changes in meiosis, a mature ovum in females and sperm in males form. These eggs are ready for fertilization with these sperm. Prefertilization events involve gamete formation, meiosis, hormonal control, and ovulation. Any disruptions in these steps can lead to fertility issues.
Join us today and take the first step toward success.